and welcome back to my YouTube channel. Today I am going to be doing my 30-week pregnancy update. As you can see by the title, and obviously you want to watch this video because you clicked it, but if you haven't seen any of my previous pregnancy related videos, I'm actually going to link down below my pregnancy playlist. Anything and everything that I posted relating on pregnancy or whatever I talked about relating to my pregnancy, it's going to be in that playlist. I will also put it in the card above here for you guys, the little eye above here in the corner for you guys to check it out if you want to. And if you haven't checked out my previous vlog, then you should go check that out as well. It's the previous link down below. As per usual, every single update that I've done so far, I answer 4 different questions. So let's just get started with the first question. So the first question is, how much do I weigh so far? And like I said, I am 30 weeks, and like the title says, I am currently 139.2 pounds. Comparing to last 2 weeks, in my last update when I was 28 weeks, I was actually 138.2. So I officially gained 1 full pound since then. So question number 2 is, how big is the baby right now, or how big is the fetus? And I use 3 different apps on my phone. I did mention it before, but I will mention it again. I use Babycenter, The Bump, and Ovia. So if you guys want to check that out, not sponsored by the way, but I do like those 3 apps because there's a variety of different articles and things that I can, look up, and I can even ask questions. The baby size for this week is a zucchini, number 1. A green cabbage, number 2, and a cantaloupe, number 3. So all 3 apps show different sizes, and that's why I also like it, because you get different comparisons, and I really like the fruit and veggie comparison because it's actually really cute. Question number 3 is my symptoms, and I actually have a pretty long list of symptoms. So the first one is back pain, which I am obviously not going to get too much into because back pain is a very big normal symptom that pregnant women always get, and plus it's because you're gaining a lot of weight, so there's a lot of strain on your body. And my symptom number 2 is uncomfortable sleep, which is also a given and which is also mentioned a lot in all the articles that I've read, and also my OB has mentioned it a few times as well. You're gonna have uncomfortable sleep, and you shouldn't be sleeping on your back because it cuts like circulation, but sleeping on your sides, whether it's the left side or the right side. I personally really like sleeping on my right side because that's the most comfortable, but for some reason sometimes when I sleep on my left side it's not as comfortable. But I did read an article saying that you should be sleeping on your left side, but honestly it's whatever's comfortable for you. But the next symptom I have is leg cramps, and basically leg cramps kind of go along with rested leg syndrome, and rested leg syndrome is not really that serious. Like, I say it and it sounds serious, but it's actually not that serious. It's basically, your body and your muscles and your ligaments are getting prepared for labor, and it makes you feel like you need to move your legs a lot. Like when you're crossing your legs or when you have your legs still for so long, you just have the urge to keep it moving because it feels like it's either like sleeping, or you feel like the blood circulation just stopped and you don't really feel your leg as much. So my next symptom is hemorrhoids, and I did mention this in my last update as well, and I use Preparation H, which I actually don't have right now to show you guys, but I did show you guys in my last update. Preparation H is not a prescription drug. You can actually get it at Walmart or any drugstore, but you can find it on like the shelf, so it's easy. You don't need a prescription or anything. But for the past 2 weeks it's been pretty bad for me. I've been getting a lot of bleeding vessels. The hemorrhoid situation just doesn't help at all. I actually had like bleeding vessels for about almost a week, and honestly it was the most horrible thing I've experienced. Second to vomiting and just feeling nauseous, that is the second worst thing about pregnancy. I don't know if every woman gets hemorrhoids, but for me, I thought it was going to be okay because in the beginning when I started getting it, it was perfectly fine. I didn't have any bleeding, nothing. It was just like the bump or like the vessel coming out, and even sitting and walking was normal to me, and I didn't feel no pain whatsoever. And then I spoke too soon, and then I got the worst of it. But my next symptom is frequent urination. I'm going to skip over that because that's obvious. But my next symptom is actually bleeding and sensitive gums, which happens whenever I brush my teeth. And honestly, since like a few weeks ago, I started getting a lot of blood every time I brush my teeth. And I don't brush my teeth hard, guys. Like, I brush my teeth the normal amount that I did before I was pregnant, or even like during the beginning of the pregnancy. I didn't get any bleeding gums at all. Yes, they are sensitive, but they started bleeding a lot more. But obviously, you know, bleeding gums don't really last that long, so they do go away. But it only happens when I'm brushing my teeth. So yeah, I guess I shouldn't brush too hard, but the way that I brush is like normal to me, so I don't think I'm gonna stop. But I feel like after I give birth, the bleeding gums will go away. But my last symptom is nausea and throwing up, and I actually threw up once in the past 2 weeks because I overate. And I also read an article saying that you should eat small portions, or when you're eating, don't eat until you're like full, or until you're stuffed. Eat until you are content only. And I think that's the reason why I threw up. But it was a disaster. I was at home by myself. I was actually using the washroom too, and let me tell you, I was doing number 2 and I did not prepare for it. I threw up all over the tub. I literally just ripped open the curtain and then threw up all over the tub and the wall. That was the only time that I threw up, but I did feel nauseous the other day as well, which I don't really know if it's normal, but I've been reading on it, and apparently sometimes if you have like nausea and you feel like vomiting in the beginning in the first trimester, it will go away in the second, and then it will kind of come back in the third. But I feel like it's just because I'm eating too much, and since the baby is like putting pressure on all the organs inside my stomach, my appetite is a little bit smaller and I tend to just eat a regular amount. But to me now, it's too much, so I have to eat like half of the regular amount that I usually eat. Question number 3 is my cravings. I'm just gonna go through it quickly and not touch upon any of it because I kind of feel like sick. I'm not trying to make this video too long, but I have 3 cravings, or I had 3 cravings. Number 1, ice cream sandwiches. Number 2, spicy instant noodles. I just really wanted that instant noodle tom yum ramen flavoring, and I got it. And also chocolate and candy, which is normal to me. And yeah, basically those are my cravings. And question number 4 is not really a question, I just show you guys my bump. So I shall show you guys my bump. Okay, so this is what my bump looks like with the shirt on. I'm getting actually really big, and here is my bump. And just to let you guys know, I actually don't really have any stretch marks, and if I do, they are so light and they match my skin so much that you cannot see it at all. But here is the front view, and like I mentioned here, you guys are probably wondering like why it's so red here. It's because I have 2 scars here, one from my top belly button ring and then one from my bottom belly button ring, and I guess the pressure on it is making it like red, so that's the reason why. But my belly button has not popped out yet. It's like right here, but it hasn't popped up yet, and I hope it doesn't. I hope it stays an innie, not an outie. And this is the other side. Yeah, I don't know if you guys can see any stretch marks, but I don't think I have like visible ones. Maybe not right now, but that is basically my bump. And that is everything for this video. I'm actually going to link down below all of the apps that I use if you guys want to check it out. And yeah, I am going to end this video here. I hope you guys enjoyed it. I know it's very quick and simple because, you know, it's very self-explanatory, but I really wanted to share with you guys what has been going on, especially the symptoms, because the symptoms are very important. And yeah, so basically this is my 30-week update. I am officially 31 weeks in like 3 days or something like that. But in my next update, I'm actually not going to be doing it in 2 weeks. I will be doing a 35-week update and a 39/40 week update if I make it to that time. So after 35 weeks, if I don't do a 39/40 week, then I probably gave birth earlier than normal. But if I give birth on time, or if I give birth later than 40 weeks, then I will be doing a 40-week update. So look out for that. 35 weeks and 40-week update. My bathroom is making a lot of noise, but I hope you guys enjoyed this video. Don't forget to like, comment, and subscribe by clicking the red button down below. And if you actually click the bell button, then you can get push notifications to know and get notified when I post. And I hope you guys enjoyed this video. Don't forget to check out my pregnancy playlist, and I will see you guys in my next video. Peace!